The Dentalpreneur Podcast. Okay, doctor, it's time to put down that handpiece. You're listening to the show dedicated to helping dentists get their lives back. It's time to decrease your stress, increase your profitability, and regain your passion. Now introducing your host, Dr. Mark Costas.
Hello, everyone. Welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas. What's up, friends? I hope you're doing great out there today in podcast land. I have a friend on today that I've known for many, many years, extremely successful practice owner of a couple dental practices called Mid-Columbia Dental, located in Kennewick and Pasco, Washington. He is an award-winning dentist and authority in implant dentistry. Additionally, he is certified in conscious sedation. During his free time, he enjoys surfing, golfing, sleeping, eating donuts, and movies with his wife and kids. What's up, brother? Welcome, Spencer Greer, to the podcast.
There's my name.
There you are.
There it is.
How you doing, bud?
Hey, Mark. I know it's been a dream of yours to always interview me, so I'm glad to fulfill that finally.
Hey, man, I've interviewed you before in person, but that was many, many years ago. It's good to catch up and good to see your face again, man. What's new in your world?
Well, what's new is that is no longer relevant about donuts. I have been on a strict carnivore diet lately, trying to heal my own autoimmune disease through food.
Oh,
So that's been a quite the wild ride of avoiding donuts, and that's sad. That's been sad.
dude. Okay, so the carnivore diet. I've heard Jordan Peterson talk about this. His daughter is strictly carnivore as well. Joe Rogan has experimented with all carnivore diet. Tell me about how it's been for you and what exactly does that look like?
Yeah, shout out to my doctor, Faustine Din, who is a functional medicine doc and wife of your friend, Peter Din.
Mm-hmm.
She's been, with this autoimmune disease that I've suffered with for over half my life. I just reached out to her and she said, we could fix this through diet. You will never need medicine again. And I said, now you've got my interest.
Mm-hmm.
So she got me on gluten-free for a while, didn't quite get the effects of it. And she said, all right, let's go hardcore. And what we call it is autoimmune carnivore. And so I'm allowed to have berries, kiwis, oranges, and leafy greens, as well as any grass-fed beef, fish, pasture-raised chicken.
Mm-hmm.
So it's been pretty dang doable. I was surprised because I'm just like, this is going to get really rote, but it's been good. Lots of ground beef in my diet.
Mm-hmm.
And I'm pretty boring at the social places, and social, when people are busting out the good stuff and I just go, shoot,
Yeah.
I don't want my diet to be the center of conversation, but still it's kind of a buzz thing right now. And it's been good. It's been good. I'm a month in. We've got at least another couple months to go. But I'll tell you what, I need no caffeine.
Really?
I have such good energy. Mm-hmm.
Oh, it's crazy. Yeah. Digestively, how's your digestion dealing with that much protein?
Yeah. So my autoimmune disease is, in my GI tract. It's ulcerative colitis. So it has, digestively, if I don't really get too much into detail about the brown stuff, I'm still pretty good given the fact that I have all of those leafy greens every day.
Mm-hmm. Okay. And like from a physique standpoint, have you noticed anything? Like you said, energy wise, you're doing okay, but from a physique, because this is about as strict of a diet as you can get as far as cutting out carbs, etc. So how's it been for your physique?
Yeah, I've lost several percentages of body fat in the past, while, and I'm recuperating from some leg injuries, so I can't work out too hard. So I'm not quite sure what it would do if I was still in my exercise regimen. But I've lost a few pounds, lost some belly fat that's been stubborn over the years. So still cranking away with that. All those donuts in the past. So
you were always fit, dude. You were always in check.
Well, given my name is Spencer, my dad called me Spinny as a kid. So Skinny Spinny was the nickname when cross country in high school. I wasn't too fond of that.
Let's talk about your dental journey, buddy. So you're a multiple practice owner, very successful dental practices. Tell me about how that all started. Tell me about how you got into dentistry in the first place. I do want to get specific about kind of your practice management routine, some of the things that you've learned over the years as a practice owner, et cetera.
Yeah, it started out with me really kind of going just with the wind of getting an associateship,
Mm-hmm.
making kind of a standard, not salary, but just income level to where I thought it was really great. Little did I know what the potential could be. But we would get so stuck in our own little island of being in our own office that we don't really know how it compares.
Yeah.
And that was way before the days that like people were really honest and on forums and a lot more collaborative. So I thought what I was making was super stellar. I then transferred over to a different office where I took a partnership route. That didn't quite work out, but there I was able to really start seeing my potential. I started doing a lot more of the necessary treatment rather than just the big filling treatment or watching things. And I remember, Mark, you and I, we used to share a common partner, common contact, and he reached out to you because I was producing big.
Yeah.
And he's just like,
Huge.
Mark, he just hit $15,000 days twice in a row. And back then, Mark, I feel like those weren't really numbers that were like ringing out too often, right?
That's true.
Nowadays, yeah, it happens. We see that a lot more frequently, but I just kind of had this knack for making my days super effective. On 4-day work weeks, I was just producing big, and it felt ethical. It felt good. It felt quality.
Mm-hmm.
And yet it can be so frowned on to produce big,
Mm-hmm.
but I always felt really good about everything I was doing.
Mm-hmm.
Fast forward a couple years, that partnership fizzled out. And so I became the sole owner of these two practices right before COVID shut us down.
Yep.
And then we just started taking off from there, hitting new levels each month, each year. My bonus structure had to just keep adapting because we were hitting massive improvements, and I'm just like, well, these bonuses are too big, and so I've got to figure out how to make either the team bigger or just the expectation greater. I felt like I was kind of putting myself in a pickle with these systems that I was setting up. So it was just kind of learning as I was going.
Mm-hmm.
The ready, fire, aim technique, pretty much.
For sure.
And then having an associate who was not really on the track of wanting to stay with me, I started looking at hiring new docs right out of school so they'd be more moldable.
Uh-huh.
And Mark, I kid you not, my guy who graduated in 2023, he outproduces what I've ever done.
Wow.
And my new guy who graduated 2020, oh, I'm sorry, that was 2022. My 23 grad, he's well on his way. He's producing big. He's having great days. We're not settling for mediocrity. And so I've basically just kind of stepped out and allowed them to flourish because I've realized in my structure, the best way to take care of my associates is to allow them to earn as much as possible. As long as we keep forward with the structure and the culture that we've created, maintain the same levels of success and grow from there. So my main practice has just been surgical. Last time you and I saw each other was at a CSI event.
Mm-hmm. Mm-hmm.
And so that's just basically what I've been focusing my stuff on. I don't really do the all on X stuff. It's just more kind of the basic implantology. Haven't really nailed down any of that marketing or any of that full arch style practice. So we're pretty bread and butter. And 4-day work weeks, we're doing really, really well. Something that I feel super proud of. And these associate dentists who I just really want to flourish because I know that if they've got the solid work week where they're just like, I'm only working 4 days a week. I have no stress outside of work hours. Greer's not involving me on any of these decisions, but he's keeping things humming. I mean, my method there is just like, they won't find a better situation working anywhere else unless they wanted to own their own thing. So my job is just to keep them super happy and keep my office manager super happy. And therefore, I think that the whole trickle down effect can really be effective.
I love it. What a great summary. So you have 3 of you guys total in 2 practices. Is that the way it works out?
one primary dentist in each practice. And so
Okay.
I'm just kind of on the sidelines. And for my new grad who has not placed an implant yet, I'm still taking care of the implants in that practice. I
Got it.
did bring on a part-timer. She's kind of phasing in slowly out of maternity leave. So, but as for full-time, 2 full-time docs, one in each practice.
What is the physical capacity in each of the offices?
6 ops in each office.
6
And
options.
so we got 2 hygienists in each.
Mhm.
We're working 4 days a week, so we could definitely grow based off of days. We do not do extended hours. If anything, we have shortened hours just to help with the culture of the offices. But we're $3 million practices in each one, and that's just on 1 doc and 2 hygienists
Crazy.
doing insurance dentistry, and nothing really too sexy and, in what we consider, full arch dentistry or any of that exotic stuff.
Okay. All right. Now we got the numbers out there. I would love to kind of dissect what it is that you're doing to train up these associates. Obviously, you've been lucky to stumble across 2 unicorns, but without proper mentorship and training and onboarding, there's no chance that they could have both developed into what they have developed into. So could you help us break down exactly what it is that you guys do that you feel is potentially different from other dental practices and how you are unique in the way that you train up your associates?
I love that question. It reminds me of a recent question that I got from a mentoring attendee that I had
Mhm.
after I'd been lecturing for about an hour to everybody. He said, "So, what's the main thing that your associate's doing in your practice
Yeah.
in order to achieve these big numbers?" And I kind of said, "Have you been listening for the past hour? Because it is all of these tiny little things
Yeah. Yeah.
I'm telling you, and it's just very, very basic attention to basic things.
Mm.
However, I feel like I just have this innate ability to find those little things and to have my little touches to where we say, hey, let's keep accountable to this aspect of your treatment planning. Or I heard this one little buzzword, which I don't think people really like. It's really just fine tuning those things and having somebody on your side to actually hear you do it, to see your results, to keep you accountable for the low days.
Mhm.
On those low days, I allow them to happen because they have to happen.
Mhm.
Sometimes we have that streak of 8 people just saying no to treatment,
Yeah.
and you cannot treat the ninth person as if they are one of the former 8.
Right.
So, you can allow the slow days to happen as long as you expect such goodness out of yourself the next day or
Mhm.
the next patient. Um, there's a lot of aspects of being a door-to-door salesman that I have in my nature from 7 years of knocking doors that I've been able to incorporate into dentistry. One of them being, if I'm at work, I want to make money. I don't want to sit down. I don't want to look at Instagram. I don't want to just kind of, you know, chit chat. I want to get stuff done.
Mhm.
So that is totally the aspect that we look at with being at work. It's like it's time to crank. I'm not saying low quality. I'm not saying unnecessary stuff. But do you remember how you shared that study about the judge,
Yeah.
the study where the judges rule more favorably at 8 o'clock and then at 1 o'clock?
Yep. The Italian judge study. It's pretty famous. Yeah.
Yeah. And so I use that to teach to my team that too. It's just like we cannot allow the 11:30 version of us or the 4 o'clock version of us to just stumble.
Mhm.
We've got to maintain the energy so that we are just staying constant and good and making sure that we're looking for the right things. So I don't really have a for sure answer for you of like what exactly are we doing, but the first thing is that when you're at work, just make sure that you're checking in with yourself of just being present. That is the absolute first thing because I think too many people just expect the good paychecks to come when they're not really putting forth the effort to make it worthwhile, to make it actually worthy of the amount that they're looking for. And there's really, really simple ways to actually put in the work to receive what you're looking for.
Love it. So do you have definitive monthly production goals, daily production goals, hourly production goals. How do you set that up with the team as far as expectations and growth and goal setting?
So I believe that uh, only a few people in the office really care for the big production numbers in a lot of the cases.
Okay.
Now, I've seen Addison's, morning huddles. He posted on DSN where it's just like you see all the 25 people or whatever, and they're talking about the big goals. To me, that hasn't worked in a way to where everybody cares about those big production goals, but there's always somebody who's your advocate, who's they want what you want. And so as long as you're in line and having those regular conversations and touches, so yes, we have the monthly goals, but yes, we also have the daily. We don't look at hourly or weekly too much.
Okay.
I feel that we get enough as long as we're looking at daily and monthly. And I never look at the year until the end. I'm just like, okay, where are we tracking to? But it's grown over and over each time. So we do have a goal to where people do get bonus at certain levels. So the whole team can have ambition towards that. And then per day, I feel like we have to have some sort of minimum to expect out of ourselves. So I'll give you an example. The other day, I had my part-time dentist that I told you about. She's kind of harder to train just because she's not in there regularly.
Yeah.
Right. If you have somebody in a couple times a month, you don't really catch momentum. So she had a $5,000 day scheduled between her and the two hygienists. And I kept going into her. I was there, but I wasn't producing. And I said, this number is going to start with a 12 at least by the time that we end the day. She's like, I believe you. I know. I've seen what you do. 2:00 comes around. It still says 5,000. And I said, we're still going to hit at least 12 today. It's going to come. We're going to create, and it's going to be awesome. We finished the day at 16,000. Given that, you just have to have a couple things on your radar consistently throughout the day and not fatigue and give in to the outcome. The two things that happened that day, Mark, were one person said yes to ortho. Yes, we do basic clear aligner. And then the second person said yes to a root canal plus the surrounding teeth. Now, what I found is that a lot of people say yes to single tooth treatment, whereas just we have to speak on a comprehensive way to where we say what's adjacent, what's on the same side, what does the patient want, and we just have to approach them as if they want everything, and then they will start scaling us down rather than vice versa. We give them the nitty gritty of exactly what will take care of the pain, and then they talk us up. That doesn't happen. So the 5 turned into a 16, and it's just through those kinds of things that you look at where you expect a certain level out of yourself. Now, nothing I told you was unnecessary treatment. It was just keeping yourself focused and efficient.
That's so cool. So, you get 10 docs in a room and you show them the same 3 patients, and, you have the same data, you have a med history, you have chief complaint, you have full mouth series of x-rays, you have scans, you have pictures, and you're going to get 30 different treatment plans, right? So what have you done in your early onboarding / training to calibrate kind of your philosophies in treatment and pass those on to your proteges / associates?
Yeah, one thing that I loved from your conversations with Jake Conway in the past was just talking about large surface fillings. And so as long as you properly delineate exactly what your moral compass says, what should be a crown, and when you're ever thinking, should this be a filling or a crown, those questions should never really come to your mind because you've clearly defined in your mind, this is a crown.
Yeah.
So if you're ever having that little argument inside of your head, should I diagnose a filling? Should I diagnose a crown? Just always say crown, because there's good reason to both of those things in your head. But in the long term, think about it. Anybody who does a large filling now that should have been a crown, you're pretty much just saying, I don't want the crown money. I'll give the crown money to another dentist in the future.
Mhm.
Plus whatever, other stuff is going to be detrimental because you didn't take the necessary precautions that day. So having that proper definition is number one. Number two is making sure that you can take care of emergencies and you're not referring everything out.
That's a good one.
So Aaron Nicholas's course, Taher's course to do root canals and extractions, and just getting in there, because what's going to happen if they say yes to the root canal? Well, you're getting the buildup in the crown today, because there's no guarantee that once you refer that root canal out, they're getting the rest of the treatment.
Mhm.
You're getting the adjacent treatment, and possibly, who knows if they're just like, you know what, I just want to get everything done, because you get the emergency stuff done, you also get the others. Now let's talk about the extractions. Are you only getting the extraction? No, there might be another extraction needed. There might be an adjacent filling or crown or root canal or something that's needed. Plus, what's always amazing is throwing that bone graft and membrane. That's nearly another $1,000 of production without really adding too much to your skill set.
Yeah. Yep.
So those two things of delineating what needs a crown and sticking to that, and then also knowing how to take care of the emergencies yourself. Now, for a good while, Mark, I was referring out almost all molar endo, but it was because I didn't have time to do it,
Mm.
right? So that makes sense if you're referring, because you're just like, that's going to take me too long. I'd rather have time to do a couple crowns. That makes more sense.
Yep.
But I mean, if you're able to, and then third thing is just learn basics through one of the clear aligners, because I think too many docs are being sheepish by saying I'm not doing any ortho. There's a lot of softball lob ortho out there, so they should definitely know how to just get some yeses to that, because 1 or 2 a month, I mean, that's automatically, when I tell people that I guarantee that they're going to increase their production by 10K a month, I mean, that's the easiest route right there.
Yeah,
just
it's
getting
2
2
cases. Yep, exactly. So, all right, so there are certain things that have to go into a high producing dental office. It's number of new patients, it's case acceptance, it's collecting what you produce. There's any number of different KPIs. What are some of the KPIs that you focus on as far as an infrastructure level from a practice management perspective?
Yeah, so we no longer do in-house payment plans. Once we started doing third-party financing, that was huge.
Oh,
And just making sure that
what's your favorite?
Say that again?
What's your favorite third party?
Oh, we used Green Sky until they weren't allowed to do it anymore when they got acquired by Goldman Sachs. They're not doing healthcare
Okay.
anymore.
Okay.
So now our favorite is Sunbit.
Yep.
Sunbit's pretty cool because it really incentivizes team members too.
Mhm.
Like they get gift cards and stuff. Now I do check in with them and say, make sure that you're not doing financing just so you can get your benefit. If
Mhm.
they can afford it, make sure that we get that. So I have kind of those checks with them. But I think it's cool that they get some extra incentive if they close some more deals.
Mhm.
Dude, I'm all about somebody else incentivizing my team
Yeah.
to close deals.
Amazing.
Sunbit's our number one.
Okay.
Care Credit, I see sometimes Proceed Finance. We don't do a huge amount of full arch stuff, so I'm not seeing too much Proceed, but that's kind of our 1, 2, 3.
Okay. Awesome. And how closely do you track case acceptance in your office, and how do you track that? Do you use software for that, or are you doing that
Yeah.
manually?
I've been a Divergent Dental subscriber for several years.
Okay.
Every night that I look at my report, I look at how much treatment was diagnosed that day.
Okay.
I don't look at case acceptance too much because I know that the main thing that we need to do first is actually diagnose. So when my associates started diagnosing $1 million in a month, I was like, wow, that's incredible.
Mhm.
Obviously, people weren't. It comes with its own interpretations that people can say to that. Some people will listen to this and say that's way too much. Look, I get it. He's in an office where a lot of people need their full mouth extracted, and so he'll always say like, "Hey, here's implants option," right?
Mhm.
So it can be a little diluted that way.
Yep.
But I know that if he's diagnosing that much and he has the ambition to produce a third of that, then we're solid, right? Um, so he's consistently producing, diagnosing over $1 million a month. Like at first that was extreme and like, wow, how did this happen?
Mm-hmm.
And it's irregular now. So, and then when I see the case acceptance on the divergent report, that tells me a lot. There's a weekly report that I look at a ton. Did you look at those weekly reports, Mark?
Yes, I did.
Okay.
Yeah.
On the bottom, it always had how many cases were accepted same day, within a week, within 2 weeks, within 30 days, and then not accepted at all.
Mm-hmm.
Right? And so what I usually look at is the bottom one where it says not accepted at all. And I have a threshold of kind of a red flag. If it's above this number, then this is a red flag that needs to be talked about. If it's below that number, we're good. We're coasting right along.
Got it. And how about new patients? Do you rely heavily on external marketing? Are you internal marketing kind of practices? How do you get new patients?
Yeah, we're not too heavy on external marketing. One office, we get about 40 plus new patients per month,
Okay.
but they're still producing about $240,000 a month. The other office, Medicaid is part of it,
Okay.
and they're taking about 100 new patients per month.
Okay.
And they're producing about 280,000. This year, they've been producing over 300,000 a month, and that's with Medicaid as well. But it's not a Medicaid office. It's just a lot of people. A lot of people come with Medicaid, PPO, and fee for service at that one. Um, I love SEO marketing. I pay somebody to make sure that we're really good with SEO.
Mm-hmm.
Pay per click with Google. I don't really do too much mailers or social media. I make sure that social media is kept up with and not super cheesy, but I'm not putting a whole bunch of money into social.
Got it. So you're a natural teacher. You've been able to kind of utilize your two practices as your own lab on being able to onboard, train, and teach associates as they come across your desk or they come across your path. That has extended to your desire to teach beyond your practices. Tell us about what you have going on as far as a mentorship program, helping people to ramp up the production in their offices.
Yeah, it was a cool starter for me, Mark, was 5 years ago, if not 6 years ago, was at your mastermind. You asked me to speak on the same subject to your group in Scottsdale.
Yeah, when you were the super producer prior to you being kind of a mentor to others.
Right.
Yeah.
Right. So I just kind of thought that what I did was kind of common sense. And the response to that was really awesome.
Mm-hmm.
And people were really just asking a lot of stuff about it. Whereas I just thought it was just basic knowledge. Later, you and I share a common mentor in Alistair. He had me speak to his group, and he's just like, you've got to spread your magic to the marketplace with this. This is too good. So I've taken that to make my own mentoring business, and it's called the Big Time Dental Producers. So our website is bigtimedentist.com. And what I've done is just kind of focused on people understanding these basic concepts and understanding that their ability to launch is totally within their grasp. It's totally within their grasp. And through that way, we can really help them to hyper focus on, okay, it's not just what comes to me, it's what I create. This treatment is constantly walking through all of our office doors. It's just up to us to actually turn it into something. It is not a disservice to speak very openly about the patient's options. It's not a disservice. It's not something to where we feel like we are making them do anything. Last time I checked, everybody has the right to sign their own consent form, to give you the credit card, to open their mouth, right? It is not me forcing them to do anything. So as long as I feel ethical about the diagnosis that I'm doing, the way that I'm talking about it, and people understanding the value of what I'm presenting to them, it can be really easy to say yes. I mean, if I came to you and I was like, "Hey, I've got this carnivore diet, and look at my six pack, which I never had until now," you'd be like, "Tell me more. How
Mhm.
did that happen?"
Yeah.
Right?
Yeah.
I don't have that, Mark. I can't show you any of that right now. But it's just very easy to build value on things, but people are selling themselves short. They're thinking that people want to spend less money, where I feel like most people just want what's best for themselves. And it's really important that we don't try to think for the patient based on the way that they're dressed or that they smell or that, how they're talking to you. You just kind of have to treat everybody for the best treatment possible. And a lot of them are going to say yes to the best treatment.
Mhm.
So that's what I've done there. And so we have multiple methods of how I'm teaching people. We do a lot through Zoom.
Mhm.
I have a couple of different methods of teaching. One is our 3-hour sprint that I do about once a quarter. Our next one is on August 2nd. And we do it for 3 hours so people can join me for that amount of time. And I just go deep dive into a bunch of stuff. And so then we have a 4-week kind of workshop type situation called the Dash. And we're starting our next one on August 16th. So all of these are on Fridays. And people can see the details on those and sign up for them on bigtimedentist.com. But like Alice there was telling me, this stuff just makes sense, and the ROI is within one day. There's this awesome dentist who you're familiar with, but he joined me and he messaged me the next morning. He's like, "Holy cow, ROI morning number one." Right? I just incorporated one thing that you said, and automatically these people said yes to 2 crowns. That was super easy. So I feel like it's just something that we can give back to the dentists who really just need to take a seize on their own financial progress.
Mhm.
I mean, all of these things are going against us, but our fees and our reimbursements are. Did I say against us? All these things are. Yeah. Sorry about that, Mark.
No, you're
All
good.
these things coming against us, including fees, not going up. So we have to figure out how to catch up to it.
Mhm.
This is a really easy way for them to do that.
Awesome. So you have a couple different tiers, or are all of these kind of offerings integrated into one program?
A couple different programs just for
Okay.
people who want different things.
Okay.
If they're just kind of looking for a couple little nuggets, that's the one session. And if people are looking for more accountability, homework, um, I mean, one guy told me after his last 4-week session, he was telling me that he was doing 2K per day, and now he's doing 5K per day. And he said 10K per day is within my reach. I know it.
Mhm.
And that was just through 1 month of exercises with me, just through 4 weeks. So it's more of a workshop type. So some people decide to do one of those with me or multiple, and then those who want to continue on with me with weekly support, we have that method too. So all pretty straightforward, all pretty easy. And I found that a lot of people have that availability on Fridays to join in. So that's when we do a lot of the stuff.
I love it, brother. I love it. So it's bigtimedentist.com and all of the contact information is there.
That's right. I love going big time. I love cranking. I love making something out of nothing.
Uh-huh.
Um,
I love
I
that
love
too.
high-fiving people, when we just turn things into something good, turning those $2,000 days into $9,000 days, turning those 12,000 into 30,000. Like those are just daily victories that I love, and I just feel like those are big time, and I just love it. So, super in people's grasp and bigtimedentist.com. I love that name. It makes me laugh every time because it sounds funny, but I just want us all to produce big time. So, if you go to that site, you'll see on the top it says Big Time Dental Producers. But I love to crank. It's just it fills my soul, when we're doing a lot of good. And Jake Conway at one of your summits, he said something so cool. And he said, KPIs are indicative of how many good services that we're doing for our patients.
It's true.
And that is a great, great message. That is an awesome message. And production can be just that. It can be just an indicator of how many good services you're doing for your patients. So I just say, let's do more. Why not more?
I love it, brother. I love what you're up to. Congratulations on all of your success in your primary practices or your primary business. And congratulations on this new development as far as your mentorship program. I know that you're going to help a ton of people.
Thanks, Mark. And, we've got a discount code for your listeners, if that's okay.
Yes, of course, please.
So, Mark, we've got a discount code for the listeners for 10% off any of these courses that they want to join. Even if they want to bundle a couple together, they get even bigger discount.
Awesome.
So the discount code is MARK, MARK. And so since our next session starts on August 2nd, and then the one after that is August 16th, they're coming up pretty fast. So just wanted to give something to your listeners. I have benefited greatly from your podcast over the past several years. And I always take your recommendations seriously. And I honestly feel confident in lying in that same category and giving major value to your listeners.
Well, I appreciate that, buddy. It was really great having you on the show today. Once again, congratulations on all your success. And hopefully our paths will cross very, very soon in person.
You bet. See you in the gym.
Sounds good, brother. Ladies and gentlemen, Dr. Spencer Greer.